Hello, my name is Sankit Para, and I'll be talking about Lyme disease. So let's just talk about the epidemiology. Most common It's the most common tick-borne infection in the United States and Europe. A total of 262,481 confirmed cases of Lyme disease were reported in the U.S. from 2007 to 2016. In 2016, the disease was the sixth most reportable disease. 300,000 have been diagnosed with Lyme disease in the United States each year, but about 8 to 10-fold more than the number of reported cases are actually uh, reported. Lyme disease is a tick-borne illness which is typically caused by three pathogenic species of the spirochete: Borrelia. Borrelia usually is referred to Borrelia burgdorferi. Uh, Burgdorferi is the primary cause of the disease in the United States. All three pathogenic species, Burgdorferi, Borrelia afzeli, and Borrelia garini, occur in Europe, and the latter two species have been identified in Asia. These are some of the nice graphs of the United States of where the Lyme cases are most commonly seen. As you can see, in the northeast, it's the most common site, as well as Minnesota and Wisconsin are some of the higher places where the Lyme disease have been reported. In terms of transmission, they are a obligate parasite that are of non-living forms. They have They are microaerophilic, grow optimally in CO2 concentrations, typically of the internal milieu of mammals and birds. Borrelia species usually depend upon an animal host or rich culture medium in the laboratory. Transmitted by ticks mainly, more specifically the Ixodes ticks, frequently encountered in backyards and outdoor recreational areas. They need about 36 hours of attachment to transmit the disease. We'll discuss more about the life cycle of a tick that will give you some more idea of how transmission happens. So these are just relative sizes of several ticks at different life stages. As you can see, these are the different life stages from the smallest to the biggest. And you can see the different ticks for different animals that they infect or they use them as a host. So this is the life cycle of a simple life cycle of a ixodes tick. What happens is that in the spring, the female lays her eggs after dropping from the animal host. This is the year one. And so in the early summer, these eggs hatch into they hatch and the tick larvae emerges. And so from these larvae, they infect the deer, mice, and feed on their blood, and these mice become infected. Now, all the infected larvae leave the mice and overwinter in the dry leaves. So that's just why in the late summer, spring time is the most common time that they're the most active. In the spring, these infected larvae become nymphs, and these are the ones that will feed on the animals or humans, and that's how you get transmitted the disease. In the fall, these adults feed on the fur of the deer and mate to complete the cycle. So this is a simple cycle of a tick. The more Lyme disease symptoms are more likely to be fatigue, headache, rash, fever, sweats, chills, muscle pain, joint pain, neck pain, sleep issues. These are some of the early Lyme. Later, you can have similar issues, but you can also have cognitive neuropathy, depression, heart-related headaches, and so on. When you look at these symptoms, more commonly you see the erythema migraine rash. I'll show you a picture about that so you can have a better idea of this. Arthritis, Bell's palsy is also it's a neurological condition that we'll talk about later. Radicular neuropathy, meningitis, encephalitis, and cardiac. Those are much less common symptoms. This is an example of a typical target rash where you can see up the erythema migrans. It's a clear rash. It gives you like a little target, often seen And so this is why this is what it is. Bell's palsy is also another case where they basically have facial paralysis. As you can see, this person is not able to smile on the left side. It's completely paralyzed. And so this is one of the symptoms of one of the resultants of Lyme disease. Uncommon symptoms after the infection, as I mentioned before, are the heart problems, irregular heartbeat, high inflammation, liver inflammation, severe fatigue. Complications include chronic joint inflammation, particularly of the knee, neurologic symptoms such as facial palsy and neuropathy, cognitive defects such as impaired memory, heart rhythm irregularities. These are some of the later Lyme disease symptoms that we already talked about, but this is something that we have to mention it again because these are complications that are more serious complications and that are hard to recover from. And diagnosis-wise, so in endemic areas, patients with probable merythema migrans and a recent source of tick should be started on treatment without blood tests, because clinical diagnosis is what we're looking for here. That most of the time, the sensitivity is not there whenever you try to use lab results. At this early stage, the probabilities of the clinical, like I said before, is high, but the sensitivity of these tests are low. Later stages, you can use enzyme immunoassay or ELISA, and if those are tested positive or are not resourceful, then you have to make sure that you do Western blot to confirm the results. Less frequently used test is immunofluorescent assay, which is not used as often. Also takes a long time to get the results back, and so it's also a high false negative and high and false positive results. So this is why it's not used as often. In terms of the high risk groups, spending time in woods, bushes, high grass, or leaf litter is some of the ways you can have exposure to these ticks, especially in the late spring and summer when the ticks are most active. Having exposed skin is a major issue, especially when you're going in any of these woods or forests where ticks can attach easily to exposed skin and start drinking the blood, and that's how they infect the humans, as we discussed before. And not removing ticks promptly and properly, it is known that if you have a tick bite, within 24 hours of it, you can actually remove the tick bite and you will not have symptoms, or it won't actually infect you, because it takes about 36 hours for tick bite to actually cause some symptoms most of the time, especially from pets, because when we take a dog out or a pet or any other pet that we take out for a walk, what we usually do is we take them to the woods and they run around on the leaves. They enjoy scratching around. That's when the ticks can attach to them, and we have to make sure that we groom them well and always be making sure that if you feel any ticks, make sure to take that out right away. So how do you prevent Lyme disease? Repellent is the most important thing. Checking for ticks daily. Shower soon after being outdoors. Call your doctor if you get a fever or rash. These are some of the preventative strategies that's been most effective. It's really simple to prevent Lyme disease. It's just making sure that you take these precautions when you go outside in the woods or any of these in these areas in the northeast, especially where there's a high risk of getting this Lyme disease. So let's say if you had a tick bite, so how do you remove it? So many people use different things, but this is the main purpose here. So let's go through these steps. You get some needle nose tweezers. Do not use a flat or dull tip tweezers, as this can cause the tick to break in half. So make sure you sanitize the tweezers and bite area. Blunt tweezers can also increase the risk of squeezing germs into the bite. So you want to make sure that you don't cut the tick into half either, so that you actually are able to take everything out. Using the tweezers, grab the tick as close to the head as possible, because this is where it's attached to you, is through that head part. grab the head directly if possible, and then slowly pull the tick out straight up to prevent any breakage. Because you're trying to make sure that this tick is not going to be attached right there. Um, that part of the tick is not attached to the body. So you want to make sure that you want to just take the tick out right in a 90-degree angle and just straight up so you can take it out safely and not have any problems. As long as the ticks are removed within 24 hours of attachment, pathogens will generally not be transmitted. However, the victim should be tested for infection just to be sure. As I mentioned before, most of the time, if you remove the ticks within 24 hours of attachment, you usually are okay. But it is also important to just make sure that you see the doctor so that you prevent any complications of Lyme disease. There are other tick-borne diseases in the United States: tularemia, Rocky Mountain spotted fever, um, Lyme disease, as I mentioned, southern tick-associated rash illness, um, ehrlichiosis, anaplasmosis, babesiosis, rickettsia, tick-borne relapsing fever. These are some of the ticks. Some of the myths that we know about ticks is to make sure that we don't use hot match, rubbing alcohol, fingernail polish, petroleum jelly, because they will just end up causing the tick to back out of the bite. It doesn't happen. The only way to remove the tick is to remove it with the tweezers. Ticks will jump from the trees and high areas on passing residents. It's rare to see any ticks other than a couple of feet, and some ticks are even blind and will not be able to see where they are jumping to. That's never true. It's only in leaves or like somewhere that's already been, that the rats or deers have been part of. That's where they usually are going to be part of. The well-known disease that people can get sick from is called Lyme disease. The correct name is Lyme. This is a pretty obvious fact. It's not causing limes or lemons, any of that. It's Lyme disease. So these are just some of the few facts. Case management for ticks for Lyme disease is usually oral antibiotics such as doxycycline, amoxicillin, cefuroximine, which resolve within 2 to 3 weeks of use. IV antibiotics are given if there's a nervous system involved and making sure that we can get rid of that infection as soon as possible so that there's no neurological complications later on and that you can have a recovery eventually. This usually takes about 2 to 4 weeks. Recovery can be slow because you're dealing with the brain, so sometimes it takes a longer time to recover from. After treatment, small number of people have some symptoms such as muscle aches and fatigue. But right now, there's a lot of research going on and been done in the regenerative medicine where people are trying to use stem cells to regenerate the loss of functions from Lyme disease and other autoimmune diseases. And so right now they're still working on it, but as of now, people may still have some symptoms, and this can just be taken care of by different treatments. But antibiotics is most likely not going to be the right to use prescription because there's no infection really currently going on in the system, so there's no point in using them. And that's really all in terms of my presentation. My references that I wasn't able to include on here is mainly Uptodate, CDC, Medscape, and yeah, and that's about it. So if you have any questions, just let me know. I'll be more than happy to answer any of the other questions. Thank you so much for your time.